Actemra is a medication that belongs to a class of drugs known as interleukin-6 inhibitors. It is available in injectable form and is used to treat various autoimmune conditions and inflammatory disorders. Indications. Actemra injection is prescribed for the treatment of several conditions, including rheumatoid arthritis, to reduce the signs and symptoms of moderate to severe rheumatoid arthritis in adults, juvenile idiopathic arthritis, to treat active systemic juvenile idiopathic arthritis or polyarticular juvenile idiopathic arthritis in children aged 2 years and older, giant cell arteritis, to manage giant cell arteritis in adults, cytokine release syndrome, in certain cases of CRS, are potentially severe immune reactions that can occur after certain medical treatments. How to use. Actemra injection is typically administered by a healthcare professional, either as a subcutaneous under-the-skin injection or an intravenous infusion. Dosage and administration frequency depend on the specific condition being treated, the patient's weight, and their overall health. Always follow a doctor's instructions regarding the dosage and administration method. Contraindications. Don't use Actemra injection if you are allergic to tocilizumab or any of the ingredients in the medication. You have active severe infections. You have history of certain conditions such as tuberculosis, hepatitis B, or heart failure. Precautions. Actemra injection should only be administered by a healthcare professional trained in the proper use of the medication. Inform a doctor about all your medical conditions, including any ongoing infections or recent vaccinations, before starting Actemra. Regular medical checkups are important during Actemra treatment to monitor for any adverse effects and ensure the medication's effectiveness. Side effects. Common side effects of Actemra injection may include, but are not limited to, upper respiratory tract infections, increased blood pressure, elevation and liver enzymes, headache, injection site reactions. Serious side effects are possible and may include serious infections, changes in blood cell counts, liver problems, gastrointestinal perforations, allergic reactions. It's important to discuss potential side effects with your healthcare provider and seek medical attention if you experience any unusual or severe symptoms.